Good afternoon. This is Mayor Jerome Prince with your daily COVID update for April 13th, 2020. As you know, we remain under the governor's stay-at-home executive order, which encourages social distancing and safe habits as we deal with this COVID-19 situation. As always the case, my administration fully supports this executive order, and we will be doing everything we can to continue to encourage people to practice safe habits. Last week, I announced that I too was tested for the COVID-19 virus, and I'm pleased to report this morning that the results came in Saturday, and the results of that test is that I am negative for COVID-19. I say that with a bit of consolation in one respect, but also I acknowledge that there are others who have tested positive who remain either symptomatic or asymptomatic. But in this instance, I want to acknowledge and express my heartfelt condolences and sincere appreciation and concern for those folks who have tested positive and who continue to deal with mitigating circumstances around COVID. This, as we know, is a situation that we all are learning from, and certainly there's been some instances where the results have come out and the implications behind the results have shown that people are suffering. So just because my personal experience was a positive one, and positive in the sense that it came back negative, I certainly don't want to diminish the importance of social distancing and practicing good habits. As I told you all, I, all through the process, felt no symptoms, and that within itself expresses the variances that exist with such an uncertain virus, COVID-19. Also, I'd like to mention that Dr. Walker will be here shortly with us as well to share specific details relative to our most recent numbers. There is good news to report today, and that is over the weekend, many of our religious institutions practiced social, safe distancing while still delivering services for the Easter holiday that we just experienced. I want to thank all of them for adhering to the governor's orders and certainly for contributing to any efforts to help keep our citizens in the city of Gary safe. Observing social distancing will help stop the spread of the virus, and in some instances, it certainly will save lives. We will continue to monitor all new interactions, all new infections that are being reported to us on a daily basis, and as usual, we will continue to share the information. As a reminder, our public parks have been restricted, most of them to vehicle traffic, but in some instances, we will restrict activity to the general public, meaning that up until the governor's executive order has been released, any gatherings of 10 persons or more continue to be prohibited within the city of Gary. I want to remind you that playground equipment is absolutely off limits to all children, as it's known that the virus can manage to present itself or remain on certain surfaces for an extended period of time. And certainly we want to make sure that we're taking all the steps necessary to secure our parks, playground equipment, and shelters as well as pavilions. Without any further delay, I want to bring Dr. Walker on to share additional information. Thank you.
Mayor, thank you very much for having me to speak to the citizens of Gary today. I would like to start off with the most updated numbers as we have them available. There has been a change in how the numbers are reported, in that the state of Indiana has now moved their reporting time for our local time from 9 a.m. to noon. How that affects us is when we get our numbers from the state, we then have to tabulate everything we know locally and provide you Gary numbers as well. So that has complicated our job a little bit. And so today, as we make our adjustments, we don't have the Gary numbers for you today. I will provide to you the Indiana numbers as well as the county numbers. So as of now, the state of Indiana has now tested 44,539 people. Of that, 8,236 are positive, and we have experienced now 350 deaths in the state of Indiana. We've had a bit of a jump up also in Lake County. Once again, the Lake County numbers currently are 796 have tested positive, as well as if you look at Porter County now has 120 positive cases. And in Lake County now, unfortunately, we've experienced 26 deaths. That's now 26 deaths. So when you have a positive case, I want to remind everybody, or even suspected positive, I want to remind everybody what the rules are. So if somebody was to test positive, okay, then they are also to be in quarantine for 2 weeks past being asymptomatic. Having no symptoms at all, you start counting 2 weeks past that point. If somebody were to go into quarantine in which they suspected that they had coronavirus, then once they're asymptomatic, we would start that count again at 2 weeks. If somebody's asymptomatic, if you have a healthcare worker like myself who was asymptomatic and tested positive, then you would start the quarantine from 7 days from the point of the positive test. So I want to personalize this and tell you my positive test, actually when I got my results, it was 5 days from when I took the test, so I had to quarantine myself for an additional 2+ days. From the point at which you take the test, you are instructed to wear masks and gloves, to wear masks in public, in which I did. And also, once you are off of quarantine, you are asked to wear a mask for 72 hours if you're in public, for 72 hours past of your isolation date, which I continue to do when I'm in stores and I'm within 6 feet of somebody, as well as you are asked as a physician to wear masks and gloves when you see patients from 2 weeks past your end of your quarantine. Now, I did not see patients at all for 1 week past my quarantine, and when I start seeing patients again, I plan to wear masks and gloves for the next couple of months, just for the comfort level of the people we are serving. I also want to share with you what are the symptoms of this COVID disease. Now, typically, you know that patients are known to have high fevers. In my case, I enter the hospital daily, so I have had my temperature taken every day for the last 3.5 weeks and have not had an elevated temperature. Also, you know, typically there can be a chronic cough, a nonstop cough. There can be body aches. There can be diarrhea. We're also now starting to see people with vomiting. We are seeing people in the hospital going into renal failure. We're seeing liver failure. And those are things that are not reported. Now, also, more and more, particularly with senior citizens, we are seeing neurological symptoms, stroke-like symptoms, seizures. So those are some of the things, and I'm sure we'll see other things to come about, including severe pneumonias, particularly when people get intubated. We're starting to see severe pneumonias. Now, I want to share some good news with you. Some of you know also that our city has received a lot of attention over the week, national attention, particularly in the New York Times. There was an article written about me and my family in the New York Times. And I want to just take this time, first of all, to thank the mayor, not only for his support in me doing my job, but just the personal support and compassion that he's shown me. Thank you very much, Mayor. I also want to thank the literally thousands of people now that have reached out to me with compassion for me and my family. I mean, I can't tell you what that means to me, and I appreciate it. I really, really do. Now, out of that, the national attention, what you will see is increased resources. One of the really, really exciting things that started today is that at St. Timothy Community Church, which is my home church, they have a large parking lot. And so we were able to establish drive-up testing for people who are considered essential workers. So those would be first responders, our police, our firemen, our EMTs. That would be our nurses, our medical assistants, our CNAs, anybody that works in the hospital. And those would be our essential workers. Now, I want you to know that I have the utmost respect and praise for our essential workers that don't get the attention that others are getting. And those are the people that work in our grocery stores. Those are people that work in our gas stations. Those are essential workers. We can't go along and have a working society without these people. They put themselves in harm's way every day. They put their families in harm's way every day. And I want to personally commend them right now. So the testing at St. Timothy goes on from today until Friday, from 9 a.m. to 6 p.m. And anybody that's symptomatic, free of charge, who fits into one of these categories can go and be tested. And I also want to commend the Indiana State Department of Health for bringing the resources here to Gary. I want to thank the National Guard, who you will see out there participating. I want to thank the volunteers that have come, particularly from the Gary Health Department, but also the people that have reached out to me from other institutions in the area to help us to accomplish this testing. Thank you so much. It does my heart so much good to see the good in people, because like I've said before, these times bring out the best in people, so we're very, very appreciative. We want to continue every day giving everybody the updates that I know that everybody wants to hear. Hopefully tomorrow I'll be able to put together our local numbers for you once again so you can hear what's the Gary local numbers. And also think about this as Illinois announced today that they're starting to see a flattening in the curve. We are not quite seeing that yet in our area, in Indiana or in Northwest Indiana as a whole. We're still seeing that rise in rate. So we're probably going to peak perhaps one and a half to 2 weeks after the Chicagoland area does. So we want to be prepared for that. In so doing that, we are attempting to establish a field hospital here in the city of Gary, and we're working very diligently to do that. And I thank you very much for your support. Thank you.
Thank you, Dr. Walker. So just a few words in closing. You'll notice that Dr. Walker and I both have on gloves today. It's certainly out of an abundance of caution, and we certainly want to set the example of how persons should travel around in the city. You know, one thing that we've concluded, or at least partially, is that a diagnosis of positive COVID-19 is not a death sentence. First of all, it's a reason to be concerned, to be certain, because what's also been proven is that this particular strand of the COVID-19 has the ability to spread pretty rapidly, and it's particularly detrimental to persons who have underlying conditions as well. Also, I'd like to point out the fact that although we've shared information about this particular situation for the last 30 days, and we've done our best to share accurate information and up-to-date information, I think it's important to note that on every presentation you'll see Dr. Walker, and that's largely because he is the medical professional who keeps up on the latest medical suggestion or direction to provide our citizens. But let's be sensible about it. So it starts with a positive diagnosis, and what should you do at that point? I believe most of the conversation up to this point has been what should we do to prevent the spread of the virus. But as Dr. Walker attempted to share just a second ago, it's also important to know what to do after you receive a diagnosis in the event that you do. And certainly the first thing that you should do is to contact your healthcare professional and receive further direction. But most of all, it's important that whatever you do, it be done so from a factual perspective. I've heard all sorts of things, such as you can take this or you can do that to eliminate your chances of getting the virus. I recently heard heard that persons who have O positive type blood, such as myself, are more prone not to get the virus. But all of those, from my perspective, are anecdotes from, the community, and certainly not given from some medical professional. So again, if you have the virus, or you suspect that you have the COVID-19 virus, or are showing symptoms, or obviously if you've been tested positive, then you should seek out the advice from a healthcare professional. Outside of that, we want to remind everyone to remain safe, stay home, limit your travel to only necessary trips. By all means, wash your hands, wear gloves, wear a mask if you're going to be in a public setting, such as grocery stores or things of that nature. But by all means, stay encouraged that as a community, we can and will get through this together, just as we have in other instances. Thank you very much, and we look forward to sharing more updates with you soon.